Tracheostomy in ICU, understanding the benefits and risks for your loved one. My name is Patrick Hotzel from intensivecarehotline.com, where we provide strategies and solutions for families in intensive care and get results for families in intensive care because we instantly improve the lives for families of critically ill patients in intensive care so they make informed decisions, have peace of mind, control, power and influence, making sure your loved one gets best care and treatment always, even if you're not a doctor or a nurse in intensive care. When your loved one is critically ill in intensive care and unable to breathe on their own, you may suddenly be faced with confronting medical decisions, one of the most significant being whether or not to agree to a tracheostomy or not. As a family member and advocate, understanding what a tracheostomy truly means, why it's done, what the benefits are and what the potential risks include, empowers you to make informed decisions in the best interest of your loved one. What is a tracheostomy? A tracheostomy is a surgical procedure where doctors create a small opening called a tracheostoma in the front of the neck into the windpipe, trachea. A breathing tube is placed through this opening, allowing oxygen to enter the lungs without passing through the mouth or nose. It is usually performed after 7 to 14 days on a ventilator via endotracheal tube or mouth when long-term ventilation is expected to improve comfort, safety, and outcomes. Let's look at benefits of a tracheostomy in ICU. Benefits: improves comfort and reduces throat damage. And why does it matter? Because it avoids long-term irritation of the mouth, throat caused by standard breathing tubes. Next, enables longer-term ventilatory support. Why does it matter for your loved one? Because it's useful if your loved one struggles to wean off the ventilator. Another benefit is easier secretion, clearance, and management. And how that matters for your loved one is it allows better suctioning, reducing risk of ventilator-associated pneumonia. Another benefit is allows weaning trials. And how does it matter for your loved one? It is more controlled attempts to breathe without full ventilator support. Another benefit is that it facilitates mouth movement and speech with the speaking valve. And why does it matter for your loved one? Because it enables potential communication once stable. Another benefit is it enables nutrition and oral care. And why does it matter? Because feeding via mouth or PEG tube is easier compared to traditional airway tubes. Another benefit is it makes transfers to step down or home possible. And why does it matter? It allows transfer to step down or home ventilation settings when stable, and with home ventilation settings, you can check out intensivecareathome.com for more information. So let's look at risks and complications families should be aware of when it comes to tracheostomy in ICU. Number one risk, bleeding and infection. The stoma requires daily care, cleaning, and sterile technique. And because the tracheostoma is a direct entry to the lung, there is a much higher risk of a chest infection and pneumonia. But so is the breathing tube in the mouth. Next risk, airway blockage from secretions or clots, can be life-threatening if not suctioned promptly by trained ICU staff. Again, it is the same with the breathing tube, however. Next, tube dislodgement or accidental removal must be replaced immediately by skilled ICU nursing team. Again, the same with the breathing tube. Scarring or damage to trachea, especially if poorly secured or during prolonged use. Delayed weaning, over-reliance on ventilation. Some facilities may delay rehabilitation once a tracheostomy is in place. Lastly, quality of life concerns. Anxiety, impaired speech, swallowing, and body image issues may arise. Again, that is also where intensive care at home might come in. For more information, go and check out intensivecareathome.com. So when should you consider saying yes to a tracheostomy? A tracheostomy may be appropriate if your loved one cannot breathe independently after 2 weeks on a ventilator. You want to avoid repeated sedation and throat damage from oral tubes. There is potential for recovery but need for prolonged respiratory support. You plan to take your loved one home with ventilator or tracheostomy support with intensive care at home. Go and check out intensivecareathome.com. It may not be appropriate if the medical team believes recovery is not possible. The goal of care has shifted to comfort only, which is a palliative care approach. Questions to ask the ICU team. Ask about timeframes. How long do you expect my loved one to remain ventilated? Clarify goals. Is tracheostomy leading towards recovery or simple life prolongation? Request a written care plan, include weaning strategy, infection control. Know your rights. You have the right to question, seek second opinions, and reviews procedures that don't align with your loved one's values. Key takeaway. A tracheostomy can be a bridge to recovery, improving comfort, communication, ventilator weaning, and even enabling the possibility of going home with specialist services such as what we offer at Intensive Care at Home. And you can find more information at intensivecareathome.com. As a family member, your voice is critical and vital. Ask questions every step of the way and ensure that decisions being made in ICU truly align with your loved one's long-term hopes, dignity, and quality of life. Now, final thought, before also you're signing up for a tracheostomy or you give consent, you need to ask one very important question. The most important question is, what is the ICU team doing beyond the shadow of a doubt to avoid the tracheostomy and get your loved one weaned off the ventilator and the breathing tube? That is the most important question to ask, because I've made a video about it and a blog post, how to wean a critically ill patient off the ventilator and the breathing tube. Go and check that out. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my video, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.